in our EMT refresher lecture on at-risk populations. In this lecture, we'll be discussing two particular at-risk populations. The first is the victim of human trafficking, and the second is the victim of domestic violence. This lecture isn't particularly in depth, but sort of touches as an overview of some of the things you may or may not see dealing with those two populations. So our objectives for this lecture will be to recognize the unique characteristics of at-risk populations, determine the appropriate action of EMS professionals in the presence of at-risk patients, recognize circumstances that may indicate abuse, domestic abuse, human trafficking, non-accidental trauma, and then state the appropriate actions of EMS professionals, us, in the presence of abused patients. Okay, so at-risk populations. Pediatrics are of particular concern because of their wide range in development. From neonatal to young adult, they go from nonverbal to highly communicative. Response to shock changes with organ development in terms of how they respond to injury. And then injury and illness patterns change with development. These folks, pediatrics, depend on adults for protection and prevention of not only abuse but exploitation in the realm of human trafficking. Other populations, the geriatric. So fragility is a better indicator of their risk than age. So, there's cases that, so think of this too as it extends into abuse of, say, the geriatric patient in a assisted living or a nursing home facility. With that fragility, right, so there's that physical fragileness, right, the inability or the decreased ability to be able to perform ADLs or activities of daily living. And then mental fragility is particularly for the geriatric, that age-related cognitive impairment or, dementia, delirium, Alzheimer's, for instance. With the geriatric, but it can be with people in general that are at higher risk, or this polypharmacy. So for the geriatric, we see polypharmacy typically with just a wide expanse of medications, and then you factor in this delirium or Alzheimer's or dementia, and that puts them at greater risk for abuse. Polypharmacy for other populations, that child all the way into adulthood, think about things such as drug abuse or the using of substances, and with that, many have certain drug interactions in this polypharmacy. So, for instance, like alcohol and pain pills don't mix, regardless of what you think or what you've experienced. But it does put people at risk, as an example. Other populations, so in furthering with the populations at risk, right, this loss of independence, and then we'll bounce back here to the geriatric, they may have a reduced uptake of certain medications or of their compliant, the medications they really need to function. And so this puts them at risk as well as their capabilities decrease. Another group that is at risk and is not on this slide is immigrants, legal or illegal. And in a survey of Tennessee law enforcement officers, in order of populations at risk, it would be non-U.S. citizens or immigrants, minors, so immigrant minors, then immigrant adults, then U.S. citizen adults, U.S. citizen children or minors, and the U.S. citizen adults, right? And so that is another population which may become, as we talk about difficulty in ascertaining what's going on, Not only do you have a population that is here maybe under questionable circumstances, now they are, or circumstances that make them feel very vulnerable in terms of their interactions with authority figures. Then you may have a language barrier and a trust barrier as well. And so that kind of complicates or compounds the difficulties in getting good information, treatment, and care for an immigrant population that may be exploited. So some indications of abuse. Physical signs of potential abuse, and these are from most likely to least likely. So this is more with the domestic, I say more with the domestic violence, but think of this from a domestic violence perspective, and then we'll see though in the human trafficking perspective, these folks get treated a lot like the domestic violence. Intimidation and coercion are powerful tools in getting victims of human trafficking to do what folks need them to do. And to think of human trafficking, one of the things to consider is human trafficking is slavery. Okay, and there's been a prevalence of human trafficking, and we'll talk about it a little bit later on, that the internet has actually assisted in the exploitation of certain populations and the enslavement of certain populations or of peoples for anything from sex working to sexual abuse to folks that are forced to do work, to labor against their will. Okay, so physical signs of potential abuse from most likely to least likely. The face, arms. Okay, so not just at the wrist, but kind of further up into that bicep, tricep, that upper arm area. The head, the back and buttocks. Okay, the breasts, particularly in women. Okay, the abdomen, and it increases during pregnancy. So for the abuser, potentially the either the father or someone that is having some difficulty with the concept of that person being pregnant in that domestic violence situation. That's unfortunately a target of, or two targets for the price of one. Genitalia is also an area of potential abuse, and so also from our perspective as responders, as people that will be assessing, we kind of go from most easily assessed to less easily assessed, right? For most of us, we can assess face, arms, and head fairly easily. We can at times make it fairly easy to talk to a patient into, hey, can I just check your back out real quick? As a guy's under for some other, to explain it that we need to do it for some other reason, but just to get a good look. Breasts can again, now we're starting to get into that more intimate piece. We want to respect people's privacy. We want to respect people that have been victims, but at the same time, we want to glean as much information as we can. The abdomen can be somewhat easy to get to assess, and the genitalia, that is usually there needs to be a pretty good reason, right? We don't tend to do that sort of exam in the field. With these injuries, these sites of injury, you're also looking for various stages of healing, right? So fresh bruises to bruises that have progressed to kind of that blue or purplish or even yellowish green, right? That kind of moving towards healing as that blood starts to get reabsorbed back into the body. Pardon me. Swelling, edema around joints and at bone sides with deformity, those sorts of things. We need to keep an eye on those. Just keep an eye out, even regardless of socioeconomic status. Those are things that we need to kind of perk our ears up. And some counties now, actually, if a child is if EMS or fire is called to assess a minor patient, so a child, law enforcement is dispatched as well, just to make sure that there's nothing further going on other than what the reported complaint is. So some indications of human trafficking victims. So the signs of abuse are going to be similar to domestic violence or other abuse victims. The particularly the sex workers may have urinary difficulties, pelvic pain, and referred abdominal pain, and rectal trauma. You may also see chronic back, hearing, some cardiovascular respiratory problems as a result of forced manual labor and unsafe conditions. So we tend to think of human trafficking strictly as like a sex worker type deal, prostitution, forced prostitution, but it also extends to folks being used for whatever reason, enslaved, if you will, to perform any sort of work, whether it's sex work or even manual work. Okay, we'll see malnourishment and or serious dental problems. You may see some disorientation, confusion, and phobias, or panic attacks, and these are going to be a result of this daily mental abuse, torture, and for some folks, culture shock. Right? If you've been living in, I don't know, very rural China, for instance, and you're brought to Los Angeles as an example, and that may be quite a bit of a culture shock. Some other indications of human trafficking. Individuals claim to be adult, but their appearance suggests that they are teenagers or children. They're adolescent. A fear of authority figures, particularly with those that may be involved in sex trade. They may talk about an older boyfriend, or they may actually talk about having intercourse with older, much older individuals, an older boyfriend, an older father figure, so to speak. And for that sex worker, they may have possession of a variety of hotel keys or hotel key cards, and that may be just an indication. So in Tennessee, from a 2013 TBI report, which looked at the geography of human trafficking across Tennessee, and it was in response to a 2011 study that was done. Interestingly, Coffee, Shelby, Davidson, and Knox counties were all classified as having over 100 cases of human trafficking in that 2009-2010. Okay, so again, it takes a while for the data to come in. Another interesting point, though, however, is that Tennessee actually scores very high in its response to human trafficking and its enforcement of human trafficking laws and the sentencing of people convicted of human trafficking, with a 93% Tennessee grades out at about 93%. One of the things that's become problematic, and you may actually run into in your own locale, is that the internet has created this 21st century geography, which was coined in this report, in this 2013 report, TBI report. And basically, this 21st century geography is that, if you live in a rural area and you're, let's say, we'll take particularly in the context of the sex trade. It allows for contact and shopping of sex easily by using the internet. So, as an example, there's probably a bunch of different resources out there, but say, for instance, a simple search on Craigslist, which said, searching for a certain type of individual to have a sexual relationship with. Nothing shows up in that small query of of the person's location, so they expand it. So, for instance, maybe you're, I don't know, West Tennessee, in a very small town, and you widen it to, say, even Memphis, and then in this report by the TBI, there's a very good example of an individual from a very rural area looking for a sex worker, none in their close jurisdiction, in their close location, but they are able to expand to, say, Memphis, make contact with an individual, and then just through a simple Google map from one place, point A to point B, they find out that within a very short amount of time that individual can be brought to them in their very rural setting without them having to do much of anything. So as we assess and evaluate, and again, one of the things that's interesting about Tennessee, particularly, is that um, Tennessee is very progressive in their management and assessment of, by law enforcement particularly, of human trafficking. Um, and again, and so this lecture is kind of dealing more with the human trafficking piece, but um, so with regard to that, as you think about Tennessee, right, Interstate 75, Interstate 40 are these huge hubs or these huge lines that get folks basically across the United States, right? They're very important. Those of you that run car wrecks on these highways understand and know very well that you can't shut down lanes for extended periods of time, or people start to get really nervous. Well, on the other, one of the consequences of that, not a consequence of that, is because it is so easy. It's such a major transportation access point that this is one of those. Tennessee is is a way to get from to New York from Texas. Workers, sex workers, manual labor, so on and so forth. And so you may run into them just as you're called for assistance on law enforcement on what seems to be a pretty routine traffic stop. The assessment and evaluation of victim of domestic violence and human trafficking, it can be challenging to assess, right? They can be very avoidant in what they say, even looking at you. Okay, they may be unreliable historians, and by that I mean like how they present their illness or how an injury occurred, how previous illnesses or injuries occurred, current or past medications or treatments. I broke my arm and blah blah blah. I broke my arm before. Okay, well, where'd you break your arm? And they may be very hesitant to tell you, well, I broke my arm in Nashville 2 years ago, because they don't want to, they don't want to give any information away for fear of reprisal or retribution from their abuser. So even in that domestic violence perspective, right, the husband, the victim may be afraid of their husband, or the husband could be afraid of his wife, right? Domestic violence is not just gender specific, right? It can be man versus woman, woman versus man, female to female, male to male, and so on. And the other piece of this domestic violence part is that children we may have difficulty communicating with because of age, maybe some cultural differences, so on and so forth. The reliance on a caregiver also may appear apprehensive to give information without the caregiver, or they may look approvingly as to whether or not they can answer questions should the caregiver be in close proximity to you while your assessment is going on. We want to look for this interpretation, a proper interpretation of the patient's verbal and nonverbal communication. We want to interpret the physical examination findings, because getting patients to care is what we want to do, because nothing is really going to occur right then. And taking care of the domestic violence or the human trafficking piece is one of those parts that you always want to have law enforcement involved with, particularly if you're at residences or you're, say, for instance, outside of a hospital setting. You want to assess the environment in which the patient was found and the need for additional follow-up. But again, that follow-up is a law enforcement piece. It's a Department of Health and Human Services. It's a Homeland Security issue. It's not a, Jimmy off the ambulance cruising through, because you're gonna put yourself at risk should you choose to do that. Also, with this assessment and evaluation, there is no need to press, right? You're not doing the cross-examine, you're not cross-examining like I don't know, like Matlock or something, trying to get the big, yes, I've been a victim of human trafficking or domestic violence, right? Um, you just want to glean as much information as you can and be able to report your observations to the appropriate parties. So treatment, we want to be supportive. We don't want to make accusations. We don't want to, browbeat them into telling us what is going on. We need to make them feel comfortable. We need to make them feel empowered. So we put things in their hands. Would you mind telling me blah? If you don't mind, for instance, try to empower your patient as much as possible. This is just a good general rule of thumb, but particularly in those folks, those domestic violence folks, those human trafficking folks that have been involved in powerless situations for a very long amount of time. You may find you get better results in terms of information and cooperation should you empower them and make them feel as though they're making all the decisions and not you. You're going to provide good supportive care as always. You're going to treat your injuries and illnesses as usual, and you always want to document your findings. And then know whether or not state law requires mandatory reporting of abuse. So if you suspect it, you should report it as a general rule. Certain agencies will have, like your local EMS or fire agency may have a chain of command that they want that to go through, but you can also report things anonymously. A couple of places that you can report these to are local, state, and federal law enforcement, physicians, nurse practitioners, and physician's assistants, and then hotlines. For instance, with the human trafficking, the Tennessee Human Trafficking Resource Center hotline is 1-855-558-6484, and then you can see the lower two. And so, like the National Human Trafficking Hotline, if someone appears like they may want some help, but you can't remember 1-800-373-7888, just say, hey, text "be free," and you can get some information on getting some help. So this concludes the basic overview of some very rudimentary information on domestic violence and human trafficking. These folks truly do need our help, and I know that we can do good for all.